You know, if I talk to some of the orthopedic surgeons or other providers and I tell them I want to, work with your patients that have hip osteoarthritis that aren't candidates for surgery, they'll just look at me and say, well, why? There's no cure for arthritis. There's no cure for aging. And that is true. And what we want to do, we need to educate providers and we need to educate the patients that we're not actually treating the arthritis. We're treating the secondary effects of the arthritis. So why would we even bother with this? Well, let's put it this way. If you're somebody that has to wait 4 or 5 years because you're just not bad enough yet for surgery, but you're bad enough to not be active, when us humans don't exercise or stay active at least 30 minutes a day, our risk for other comorbidities such as heart disease, cancer, stroke, diabetes, obesity, addiction to narcotics, gastrointestinal disease related to taking over-the-counter medications, depression, they can't work, lost wages. It is really dramatic how it affects the individual. So it's not just about trying to fix their arthritis, it's about we need to get these people moving again because they cost the medical system millions, billions of dollars per year. Right now, arthritis by itself costs the US healthcare system over $100 billion a year. And so if we can actually get these people moving, let's say their pain level is a 7 out of 10, 10 being the worst pain imaginable. If you can shift them from a 7, maybe even down to a 3 out of 10, that really helps them a lot. Maybe they'll be able to reduce their medication usage and then get them just active enough to prevent or decrease the risk for these other comorbidities. It really depends on the severity of the arthritis. So a lot of people that come to me with severe arthritis, you just have to tell them, you're a candidate for surgery now. It's too late at this point. So we really want to educate a lot of people that if you can come in sooner, if we can get diagnosed, find these people earlier, studies show us that if we can get our hands on them and get them on certain exercises, although we can't stop the aging process, we can work on this tightening of the joint capsule. We can work on the weakening or the atrophy of some of these important muscles like their glutes and their muscles around their hip and knee. If we can keep them moving, the old saying, if you don't use it, you lose it, and that's true. Humans need to keep their bodies moving to stay lubricated, keep that WD-40, if you will, moving their bodies, that nutrition around their joints. So we work not on the arthritis itself, but the byproducts or the secondary effects of that arthritis, and we can make an effect on those structures.